Swetha Desiraju. I am the founder of the 𝗨𝗏𝗁𝗀 Foundation, which is a mental health NGO based in Telangana. I am also in the final leg of my master's in clinical psychology, and soon I will be practicing as a psychologist. I will be working in the field of neurodevelopmental disorders, which I am extremely passionate about. And to begin with, I would like to start by thanking Lavanya Garu for inviting me on this show. It is honestly a pleasure to share my story along with such other inspiring people. So the thought of making a difference in the field of mental health and the thought of changing the perspective in which mental health is viewed in our country has come to me at a very young age, owing to my personal experiences of seeing my loved ones suffering from mental illnesses, seeing the distressing effect of mental illnesses on my loved ones. And I come from a home where my house is has always been filled with anatomy textbooks, medical journals, medical conversations, and my family has always been very open about mental health conversations, about discussing about my emotions. I always had a safe space to talk about my emotions, to talk about however I was feeling, if I was sad or if I was anxious or stressed or worried. They made sure that I always had a safe space to talk about my feelings. And this encouraged me to explore the field of medicine. And I had always wanted to be in the field of medicine, coming from a family which is predominantly in medicine. So it took me 3 years of hard work when I wanted to write a medical entrance examination. It took me 3 years of hard work. I worked day in and day out, 3 years of dedication, sacrificing my sleep, losing food, so many things. And it was in these 3 years that I clearly understood the impact that mental health has on a person and how important it is. We usually do not consider mental health to be very important, as in we are very open about our conversations about physical health. If we ever are down with a fever or if we catch a flu, it is very easy for us to have that conversation. We openly talk about it. But I realized in those days that it is not the same about mental health. If we have to talk about being sad, it takes a lot, and the other person also finds it very difficult to understand how to talk about mental health. So in these 3 years, I had realized the importance of mental health. And after 3 years of preparation, dedication, and everything, on the day of my entrance examination, I went to my father and I told him that I'm not going to write this exam because I don't want to be in medicine. I want to be in the field of mental health completely. I want to be in the field of therapy. So my father was a little surprised because I had sacrificed everything for that one exam. And when the moment actually came, I told that I had different plans. But like I said, my family had always been very supportive of the decisions that I made. And coming from the field of science themselves, it was pretty easy for them to understand where I was coming from. So all my dad asked was, "Are you sure?" I said, "Yes, Dad, I've never been more sure about anything in my life." And he's like, "Go ahead, we're right behind you." So like that, my journey in the field of psychology has started. And in my 5 years of education so far in the field of mental health, I was fortunate enough to have had these experiences of internships at various hospitals in Hyderabad. And it was during these years of internship that I could see mental health from various perspectives. Until then, I could only see mental health from a very layman perspective. But it was during these internship years that I could see a very proper and clearer perspective of mental health. And I felt like in the field of mental health, an ounce of prevention is worth a pound of cure. And it was also in these years that I started doing community service. So in my 5 years of community service so far, I have worked on various projects for empowering women, promoting education, normalizing menstrual health and hygiene. And through all this, I felt like one thing stood out. As in, whenever I went to speak to a child, I could not address anything else before I addressed about their mental health. It felt like it ultimately boiled down to their mental health. So that was when I started feeling that something should be done exclusively for mental health. It should not be just spoken about when we are talking about other things. Rather, we should prioritize mental health. So when I was 18 years old, I remember vividly having this conversation with my dad. I remember telling him that in India, we are already doing a lot for the treatment of mental illnesses. We are growing tremendously. We have excellent psychiatrists, psychologists, therapists, counselors, coaches, everybody working for the treatment, for the cure of mental illness, but we should be doing something to help prevent mental illness in the first place if we can, to develop more protective factors as we grow up. So this conversation, and then I remember promising my dad that in the next couple of years, I will be starting an organization that will work predominantly to prevent mental illnesses, and also an organization that covers holistic well-being, that considers holistic well-being. So since that day, when I was 18 to today, my every day has been about this one dream of mine. I worked day in and day out, learned so many things from every experience of mine. Every day I was learning something new to ultimately lead me to this day today. So it was in these 5 years that I also met so many people who shared very similar vision, who wanted to make a difference in the field of mental health, who wanted to be there for other people because they themselves know what it is like. So that was when we all came together. I met all these people, had many conversations over our cups of tea, shared our dreams, and finally in November 2020, we were able to establish our organization, the 𝗵𝗫𝘁𝗶 Foundation. So the 𝗵𝗫𝘁𝗶 Foundation is a mental health NGO, and it works for the enrichment of social, emotional, and mental well-being of the people of India. And resultantly, we are planning to build mentally healthier communities in India. So when we all came together, it felt like pieces of puzzle that came together to form one entity. So all of us came together and we started thinking about what we need to do, because one thing that we wanted to follow at 𝗵𝗫𝘁 was to leave no one behind. When it comes to mental health, we have to consider the entire population, all the age groups. So we wanted to know, where do we start first, right? We want to cover the whole thing, but where do we start first? So in these conversations, we decided that we were looking back upon our own lives. And I think we can all relate to this, that when we look back upon our lives, I think we all feel like when we were younger or when we were teenagers, we all felt like we wished we had at least one person for us, one person to understand us, one person to understand our emotions, help us understand our own emotions, and help us understand how to deal with our emotions, how to form strong support systems, how to make responsible decisions. And to put it in very simple words, we all wished we had someone to be the wind beneath our wings. And that is the reason we at 𝗵𝗫𝘁 decided that we will be the wind beneath the adolescents' wings. And that is our very first project. We work in the field of social emotional learning to begin with. So we ensure that children learn about themselves, that is self-awareness, self-management, navigating relationships, which are so important to us in our lives, forming strong support systems, making responsible decisions, learning how to be there for someone with mental illness, because nobody really teaches us these things in school. And this is the important thing that we have to learn as children, as adolescents. So that is why we started this project. And through this project, we aim to be the wind beneath their wings. And when we talk about building mentally healthy communities, we at Brightside, we understand that when we want to go out and build mentally healthy communities, it is very important for us to be a mentally healthy community in ourselves, for us to have a mentally healthy community in itself. So that is why at Brightside, we believe that we rise by lifting others. So at Brightside, we always ensure that we hold a very safe space for each other. We are there for each other, and we are always lifting each other up, resultantly creating a mentally healthy community in itself to begin with. And in this journey, throughout my journey, the journey that has been and the journey that is going to be, there are 4 pillars of my life that I strongly stand upon, that form the foundation of my being, and that act as the driving force which inspires me to be better every day. And undoubtedly, these 4 pillars will be my dad with all of his nurturance, my mom with her unconditional love, my brother being my rock, and Team Brightside. I couldn't have done all of this without the support of these people in my life. And to conclude my journey, to conclude my speech, I would like to talk about the importance of mental health. I would like to urge everybody to take their mental health very seriously. It is as important as your physical health. Prioritize your mental health. And when situations get a little unbearable, or when you feel things are a little overwhelming, or when you feel a little overwhelmed, please don't be afraid to seek professional help. There is no shame in reaching out for help, and there is no shame in being there for somebody who needs help. There is bravery in seeking out help. Your mental health matters. And in this journey, while I was going through it, there definitely have been a lot of setbacks. And every time that I did encounter a setback, it always gave me more fuel to keep going. As in, if I ever did not get into the university that I kept dreaming about, I always looked at it as that something else is waiting for me, something more beautiful is waiting for me. And throughout this journey, there definitely have been a lot of setbacks. And every time there has been a setback, I always looked at it as a chance to rise higher, as a chance to show that this obstacle that I'm going through is not going to get me down. I can't let this obstacle get me down. And one thing that I always keep telling myself if I ever cannot go through something is, I did not come this far to only come this far. I have to keep going, because there are so many dreams that I have to fulfill, so many promises that I made in the field of mental health for myself, which I want to live up to. And there is another thing that I really believe in. It is turning our pain into power. So if you ever find yourself stuck in a situation, or if you find yourself in a setback or in an obstacle and not knowing what to do, just turn your pain into your power. It is very important for us to see the situation, but do not ever push it away. If it is something emotional for you, take a moment, sit through your emotion, feel it, and then let it go. We have to feel our emotions. A lot of people tell us that we have to push our emotions aside to achieve success. But trust me, we have to feel our emotions, but we should not let it consume us. We have to know to feel all of our emotions, to validate our emotions. And when we do this, we are able to be stronger versions of ourselves, and we will be able to turn our pain into our power. So if you ever find yourself stuck, please remind yourself to turn your pain into your power, and you did not come this far to only come this far. There's a beautiful journey ahead for you. Thank you.